Welcome to Feminine Systems podcast, where we not only heal or empower women, we also reimagine systems around her. I'm Dr. D, an integrative gynecologist, an author, and an entrepreneur. Hello, and welcome to the Feminine Systems podcast. Usually, all our episodes are dedicated to women all around the world. Today's episode is dedicated to couples because pregnancy is not a women's story alone. It's a shared journey. Too often, we focus only on the 9 months or on the birth. But in truth, the journey begins even much more before conception and extends into the months of postpartum or post-delivery. Today, I will walk you through this entire arc from preconception planning to navigating pregnancy, trimester by trimester, preparing for labor, and finally entering postpartum with awareness and care. The previous 2 episodes we discussed on Feminine Systems podcast were on mother's mental health, a not so popular and discussed topic. Though so many mental health issues arise in the pregnancy and postpartum, it is rarely discussed and talked about or even screened at the hospital. And the other podcast was with a trained doula. We talked about the opportunities and the support systems available beyond the medical in terms of midwife support for delivery, childbirth classes, and much more. Pregnancy never begins with a missed period. It begins with preparation. That's why I've also written a book, My First Pregnancy, which is available on Amazon. It is about my own pregnancy journey, and my own pregnancy journey between 2 children is so different. Preconception. This is a phase before pregnancy. Ideally, it starts between 3 to 4 months before planning a pregnancy. So this starts with my advice is to take a gynecologist consultation and have a personalized care for your preconception. It even starts with tests for both the partners like hemoglobin, thyroid, vitamin D, B12, sugar levels, and other screening for infections like rubella, hepatitis, HIV. For women who are planning to become pregnant, it is advisable to have their rubella shots much earlier, not in the immediate 3 months before pregnancy. Actually, women are advised to take supplements of folic acid 3 months from before conceiving. Men can also take supplements like zinc, selenium, antioxidants to improve their sperm quality. And this is a phase where a detailed family history and risk assessment takes place of genetic disorders, any consanguineous marriages, if there is very optimal weight before conception, nutritious real food, less processed food, physical activity, reducing alcohol, smoking. All this actually helps improve the quality of egg and sperm. So this has to be done at least couple of months prior to planning a pregnancy. Most don't factor in asking each other, do we want to be a parent? Now, why now? What support system do we have? Are we financially ready, prepared? As a couple, have you talked it through? Or most of them, look at it as, okay, fine, let it happen. It's God-given and just leave it, let it go with the flow. Is this the better way? Not really. I often remind couples, conception is like planting a seed. You wouldn't plant in dry soil or a dry month. Preconception is about watering the ground and preparing. Nothing like planning and preparing ahead when couples today want to have just 1 or 2 children max. They want to be at their own optimal health, physically, mentally, financially. And they also have career roles today. It was not like a division of labor like before, where a woman's role was to just sit at home and take care of kids. So how well are they prepared to handle the challenges, and the phase actually demands quite a lot of your time and presence. Let me walk you through the trimesters. We call 4 trimesters. The first 3 trimesters come under pregnancy. The 4th trimester is postpartum, that is after delivery. The first trimester is in the first 3 months, 0 to 12 weeks. This is a phase when the body is adjusting to the implanted embryo. There are hormones which are, increasing. Suddenly, there is fatigue. You feel tired, you feel nauseating. As a couple, this is the time for patience. The mother needs quite good rest and the partner to listen and support them. It's best to eat small, frequent meals. Take folic acid supplementation. Most people avoid it, but it is recommended to take it. Avoid raw foods and eating out, which might cause food infections. Avoid long travel. You'll be subject to scans at this phase and certain laboratory tests again, like sugars, your infection screen, thyroid. So these has to be optimized because the baby's well-being is directly correlated with your thyroid sugar levels very much. A viability scan and a nuchal translucency scans at 12 weeks will also be taken. Moving on to the second trimester, which is from the 13th week to 28 weeks. It's a golden period. So you feel literally normal back again, energy returns, scans are doing good, the nausea settles. It is a beautiful time for the couple to connect with each other, do evening walk, even connect with yourself and the baby. A phase of connection, I would say. Ideal time to increase your protein intake, even to start iron and calcium supplementation given by your gynecologist, and to be adequately hydrated. You can almost eat a variety of foods, a mix of a lot of fruits, vegetables, pulses and whole grains. You can have a variety of foods, like 30 different foods in a week. Most forget to incorporate nuts and seeds into their diet, which also forms a very important part of your healthy microbiome, your gut bacteria. In this phase, an anomaly scan or a scan to detect any defects in the baby is being done around 18 to 20 to 22 weeks. It's the best time for prenatal yoga, attending a childbirth class, to resume good physical activity, whatever you were doing before. And there are very specific preparation, yoga and exercises, breathing exercises tailored for pregnancy, which also can be initiated now. Usually your doctor gives you an injection, Tdap, that's for tetanus, so which is also recommended. The next trimester is the third trimester, 29 weeks to 40 weeks. This is when the body goes heavy, right? Like you gain a lot of weight, there can be some edema or swelling in the legs. You might not be, you or the baby, like by 28 weeks, the baby actually grows to weight of about 1 kg only. After that, only the remaining 2 kgs for let's say a 3 kg baby happens from 29 weeks to 40 weeks. So this is the phase where you also gain a lot of weight. Every week you gain a half a kg weight. Sleep becomes disturbed, anxiety and about birthing, all this can happen. So being prepared will actually make you cruise this third trimester and the fourth trimester, which is post-delivery, very, very easy. Know your hospital plan, talk to your doctor, and most importantly, very importantly, I would say, set up your village. Who will help in the first 60 days? These are the people. So plan for that. Prepare your family, prepare your support systems. And because it's not easy to work 60 days or, literally you'll be continuing breastfeeding for 6 months initially. So where you will not be sleeping continuously for 4-5 hours. So it's not a 1 or 2 days when you are not prepared for it. It is going to take a toll on your mental health and your physical health as you're recovering, and the hormones per se has a big role on your body. Small protein rich meals. Make 5 to 6 meals per day rather than a one filling meal. This reduces reflex. It reduces the sugar spikes. You can go for a Doppler and growth scans again if as per advised by your doctor. Some people at this stage start developing back pain, leg swelling. So practice stretches, breathing, which is very essential. Now, most couples actually, including me in my own journey, where I had my first baby after my MD in gynecology. Despite that, I stumbled, I struggled. We prepare for birth so much, but forget that baby is only half the story. The mother is the half. And we also forget the mother once the baby enters the world. It's not fair. Physical recovery is challenge itself because there is healing from birth because of the change in, the weight of the mother, like she's going back, there's like the hormones are dropping, and whether there's a cesarean section or there is a episiotomy wound because of a normal delivery. All this takes some time to heal, so support with good food and rest. These hormones can trigger tears, irritability and even depression. As a partner, spouse, Be watchful, compassionate, and proactive to your wife. Parenthood actually reshapes intimacy. It is about finding newer ways of building a relationship together. You need to mentally prepare for it and could have talked it during your pregnancy itself. Be prepared. Who's going to do the meals? Who's going to do the laundry? Who's going to hold the baby so you can have a nap? Baby care and self-care itself is a very, very huge routine. You can plan, get help, sometimes professional help also. You might need a lactational consultant so that there are not much of injuries many times many mothers face difficulty in establishing latching for the baby to breastfeed. And many of the times proper latching is not there, and what happens is there are a lot of nipple cracks happen and erosions happen, and then the mother stops breastfeeding. Then there is breast engorgement, and these things really is very, very difficult, and most people are not prepared for their first baby. So sometimes a professional help will be very useful. So if there are the wound care itself, right, is a specific area which also need to be addressed. Baby blues are common in the first 2 weeks. If sadness and anxiety and hopelessness persists beyond that, it may be a sign of postpartum depression. Please reach out to your medical support team and take support. Despite that, a calm mother is as important as her milk, and that establishes good feeding pattern and good milk secretion. Most complain there is not enough milk. I think when a mother is more unhappy and stressed, that reduces milk supply. First, try to educate the people around you, not to put a lot of pressure on you, because the whole family becomes anxious. It's a small baby, most people don't know to handle it. For every single cry or small sneeze or sometimes hiccups, people react, which are normal part of a normal child. You don't have to do anything at all. No need of water, no need of any other supplements for the baby. And they have a very different meal plan, which is, many people give you rasam rice only, which is not the ideal thing to eat during postpartum. You need to have a variety of foods so that it is very wholesome. And that's how it enriches your baby's feed as well. As a partner, as a husband, what all you can do? Ensuring your wife takes adequate water, reminding her to take her iron and calcium supplements post-delivery. Most people don't do that. Giving her a leg massage or a neck massage sometimes. Holding the baby so that she can have some nap. These are more important than gifting your wife. This kind of support and empathy is very, very essential. There are very important breathing techniques that you need to learn during pregnancy, which again, certain things which will be very helpful for labor practices. There's something called the belly breathing. You sit upright, one hand on the chest and one hand on the belly. Inhale through the nose, expand the belly fully and exhale slowly. This reduces anxiety and improves oxygenation. This can be done during your pregnancy. Alternate nostril breathing, or which is also called as one of a pranayama, which is Nadi Shodhana. It balances the left and the right brain. It also reduces your cortisol levels. These can be practiced for 5 minutes every day in the 2nd and 3rd trimester. Again, there is something called box breathing, which is 4 breaths. You inhale for 4 counts, hold for 4 counts, exhale for 4 counts, again hold for 4 counts. So 4, 4, 4, 4. This improves lung stamina and calms your mind. During pregnancy, daily walking, and importantly, this back pain is a very important issue in pregnancy itself. It starts because of the stretching of the ligaments. This is very, very normal phenomenon in pregnancy because of the baby, and the spine gets lightly stretched. So a cat-cow posture, which actually is a good back strengthening exercises. You can even Google these back strengthening exercises and you can try doing these during pregnancy. Another important exercise during pregnancy is the Kegels exercises. Your pelvic contraction as when you void your urine or your motion. So this also could be looked onto your internet and be practiced from this 2nd and 3rd trimesters. If you're very used to fitness routines, modified planks, you can go hit swimming, people can do their routine runnings, or if they've been used to that very earlier, and there is a completely low risk pregnancy, there is no placenta previa, no twins, and no other important warnings which has been red flags arised by your gynecologist, it is fine. They can go for it. And many couples can opt perineal massage from 34 weeks, which actually reduces the need for episiotomy and or a tear that happens. During labor also, there are certain breathing practices. Labor pain, dental pain, renal colic, or the pain because of a kidney stone is so painful. You can equate it. So men who don't go through a labor, they don't even understand how painful it is. If you had a dental caries, how painful it is. If you had renal stone, a kidney stone, it is so painful. It is like, it can be even more, and it is not like just 1 minute it comes. It is like, for hours it is, there are contractions which causes like pain, and it makes the mother very breathless also. So the control and on breathing is very helpful and essential. Slow paced breathing it actually calms during contractions. You inhale for 4 counts and exhale for 8 counts. Pant blow is another technique where you do during strong contractions in active phase of labor. Your childbirth tutor will be able to explain that better to you, that he-who kind of breathing is this. These helps mothers focus during the contractions and prevent premature pushing. In the second stage, exhale with a soft ah sound as you push instead of holding the breath. Very detailed class can be done and practiced for all these breathing techniques, which you can take with any of your known tutors or even your doctors who provide these courses. And we are also explaining it in detail in our courses. This reduces tearing and helps the baby descend gently. You can also talk to your doctor about different labor positions like squat, like lying on the side, rocking on the all floors. Even very few hospitals do give a water birthing options also. You can discuss all that. Not necessarily the regular flat, that lithotomy position is not the only position for delivery. So now what? Let me give you very important tips. Very, very basic tips. What to avoid? Avoid contact sports, heavy lifting, weight lifts which are heavy, more than 5-6 kilos are preferably to be avoided. Avoid overheating workouts, sauna, and lying flat after 20 weeks. Preferably a left lateral is better. Keep yourself hydrated. Most women in pregnancy and postpartum don't hydrate themselves. Iron and calcium supplementation during pregnancy and postpartum after delivery, which is, the requirements are even higher during postpartum. Small meals, less spicy, less processed. Travel is safe from the second trimester and third trimester up to 32-34 weeks, and always keep walking and moving around. Any red flag signs like severe headache, swelling is just sudden developing, blurring of vision, or there's a bleeding, there is reduced baby movements, please don't just wait and watch. Seek out your help and call your doctor immediately. Be wary of your teeth and gum infections. This can also affect birth outcomes by, there is a risk factor for it to go for a preterm or an early delivery. Mental preparation is a very, very key important thing. So as a couple, learn these breathing techniques, relaxation techniques, and maybe attend classes together. Know your emergency numbers. Keep your hospital bag ready after 36 weeks. And prepare your support at home, which is very, very crucial. So there is nothing like a shared pregnancy and planned pregnancy. So enjoy this journey. It's a very beautiful period in life.